One thing that is very tricky in a family becoming oriented to the hospital is if a family has not been in the hospital with their child, they are perhaps used to one provider caring for their child and they know their pediatrician. And they're visiting a doctor and it's a one-on-one relationship. In the hospital, there will be multiple physicians, multiple nurses, multiple therapists, and it's very difficult to know who is taking care of my child, who is in charge, who do I talk to when I have questions or concerns, because in a day in the life of a patient, they're going to meet many physicians, attending physicians, fellows, residents, interns, from their primary team, as well as physicians from what's known as a consulting team, so specialists in different areas. So it can be really disorienting and hard for families to know, well, which doctor is in charge? There are many people involved, and it's not necessarily a bad thing. In fact, it's a good thing because there are experts in many different fields, and there is an attending physician of record who is in charge of each patient, and there is an assigned team for each patient. It's just important that clinicians introduce themselves, and if that doesn't happen, that parents feel free to say, can you tell me what your role is? Are you on my child's primary team, or are you on a consulting team? And so it's a combination of clinicians, caregivers introducing themselves, and that is the standard that each person entering a room should give their name and their role and introduce themselves before doing any type of work with a child. But it's really important that families know as well that it is okay to ask and to be clear how this provider fits into the care that's offered to a child.